The environment has been...
What we're saying is have a heart.
We've got to be able to regenerate our
There'll
economy.
be people who are kind, people who are cruel, but that's life. You can be bigoted about pigeons. I'm fine with that.
The next area we want to move to is really to look at the future and see what the future holds for us in terms of cancer treatment, cancer discoveries.
If we're talking about knowing how does holistic care improve the health of cancer patients in general, just even to quote a study, we looked at colorectal cancers beyond chemotherapy. And if we looked at obese and overweight patients versus ideal weight patients who seem to have a pretty good lifestyle, individuals who, because perhaps of their less than desirable diet and habits, were obese, if they followed a reduced carbohydrate intake, they actually can improve their overall survival. So by adopting a holistic approach beyond chemotherapy, they can actually get back to an ideal weight and then for their height. They can get their blood pressure down to normal. They can get a lot of things. They can get their diabetes under control. All that reduces inflammation and actually reduces the risk of cancer recurrence. And scientifically, that has been backed over and over and over again. So I think it is probably not true that Western medicine do not embrace holistic medicine, but it takes both hands to clap. I think holistic practitioners are also gradually realizing that in the urgent stage of cancer, chemotherapy needs to be given to control the fast part of the cancer. Thereafter, holistic medicine can come in to reduce the risk of cancer recurrence. But there will be cancers which are so fast that they are not related to hormones or to any of the lifestyle changes, and those needs to be taken care of quickly.
Can I clarify here? We see a lot of these people, survivors, majority, actually always say that modern doctors do not encourage them to combine, for example, chemotherapy with any other thing. When the survivors see their doctors, modern doctors, they are being discouraged from combining holistic treatment, so-called in brackets holistic treatment, together with modern treatment. And I think that is in the majority. And I will only be able to try and explain that. Why? Because this group of doctors are not knowledgeable in the area of holistic medicine, okay, or commonly called Eastern medicine, although I do not like to use that word, okay. So therefore, my feedback is this, that what being said, both are right and wrong, in the sense that Dr. C have said that, well, she encourages, but what is actually happening on the ground appears, and that's why there are other different views, appears to be different.
I think you can be very clear. Holistic and alternative medicine, I think I see it differently. Okay, holistic approach means we use what is evidence-based together with things which we know are good for the body. For example, dietary changes, exercise, better lifestyle. Alternative medicine, going for chelation or colonic washouts or all
more
these strange,
invasive
things where, or you pump yourself with certain kinds of drugs. There's even a diet which says take only pork knuckle and you can get cured of your cancer. I mean, there are some diets which are like that. Certain diets are just ridiculous. So we tell our patients, look, you're a sensible person, everything in moderation. Certain things you must avoid, you should avoid. For example, I noticed you had one glass of wine, this is your second. The amount of alcohol there can cause your cancer on oropharynx, nasopharynx, the esophagus, stomach cancer, all these things. Every time you wash your mouth with Listerine, you can get that, especially with alcohol. But the thing is that, how much would it begin to get you in a state where you can get a cancer? We don't know. One glass of wine, 1,000 glasses of wine. So the thing is, to live moderately, I think is a fair statement. And I think majority of doctors, when they talk about holistic, they talk about, being just moderate, but not alternative, not going for funny things like going under heavy-duty magnets and things like that. That is what we call, there's in fact a website called, quackery, and we have to be very careful. Yeah.
Dr. Yang, can I ask you, what is your view of coffee enema?
I prefer drinking coffee through my mouth, not through my
Do you
rectum.
know something? As a substitute for morphine, it's been proven very effective for the last 70 over years.
Caffeine is a good, well, to a certain extent, pain reliever. It's built into some of our painkillers that we take. But you see, when you give a coffee enema, all right, doesn't make sense to me. But I mean, if a patient says, every time I go for a coffee enema, I feel better, I feel more relaxed, and it's basically the caffeine
It's
that's
a DIY
working.
thing in Singapore.
I-
You don't.
Okay, can we move back to cancer?
Just to clarify
No,
again,
it is for
like
cancer.
clarify,
It
what
is
you
the most
mentioned about the
important.
definition of holistic medicine, Eastern medicine,
Yeah.
I'm not going to comment on that, but I'm just referring to what was actually mentioned earlier on, and they were referring more to herbs. So I'm referring more to that. Okay,
Yes.
so put aside the word alternative medicine, holistic medicine, da 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 da.
But I think it's
Right.
important because when we talk about holistic medicine, when we talk about diet changes, herbal medicines that are available in nature, we're not talking about intravenous therapy. We're not talking about deer placenta ingestion. We're not talking about taking high doses of certain liver extracts, taking liver extracts from unknown sources by ingestion or by infusion. That is not holistic medicine as I understand it. So when someone says, I advocate holistic medicine, I do not advocate alternative ingestions of unknown substances.
You mean about going back to nature?
No, I'm talking about going back to nature, having holistic medicine.
Right.
Does your holistic
Right.
treatment involve ingestion and intravenous injections of liver extracts?
No.
Okay, I think here what has to be clarified.
Yes.
And can you sum up everything for us?
Let me try and sum
Alright?
it up. All right, okay. Dr. C is trying to say that modern doctors, which is correct, also practice holistic medicine. Okay, the old concept that modern doctors, okay, that's not right. I think our doctors don't practice adult medicine. Yeah, okay. At least say how is your name, say have a seat. I'm sure they do that. At least nowadays, okay. But what you all are trying to say is this, that they do not encourage them and say that the two will interact, things like that. All right, and therefore they say don't take herbs. Why I mentioned about Ling Jie example is there are herbs that are poisonous. All right, but assuming that the herb has been well researched, even by modern doctors and PhD doctors, I really feel that there should be a combination, because I myself have seen that when you combine the usual healthcare, there's surgery, chemotherapy, radiotherapy, together with good, well-researched, all right, herbs, in this case, to be more specific, herbs, I have seen it to be a blessing to the people. All right, okay. So having said that, I think I would want to remain silent after this, saying that, we will not want to go into the extreme of alternative medicine, like say chelation. I don't want to explain that, although I know about this, but I think let's put it aside because usually for cancer survivors, we're not talking about chelation. All right, okay. So therefore, put aside the extreme alternative medicine, which I will also say, please, not all the extremes. Holistic medicine, right, as what was said by Dr. Yang and Dr. C, modern doctors also practice holistic medicine. But what y'all are saying about herbs can help, I believe some doctors are ignorant of it, that's all. So please understand that. Some doctors are not schooled in the area of herbs. So please forgive that and please understand that. All right? But good herbs, I think, should be encouraged. Thank you.
I have a lot
You-
to share
can we
about,
just sum up?
about going about the way ahead, because you were asking about
Yeah.
the way ahead. I think there's a lot that can be made known to the public. I think there's so much information that is somehow not known. For example, there are many foods, many substances that are cancer causing. Meat is one big thing. There are at least 17 carcinogens identified in well-cooked meats, and for whatever reason, this information is not released to the public. I think it's not fair. I think these things should be made widely known, maybe even to schools.